Hi there, my name is Daisy. I'm an occupational therapist, and this vlog is to explain a bit more about what functional neurological disorder is. Functional neurological disorder, which is also abbreviated as FND, is the second most common neurological outpatient appointment after migraine. So it's very common. I saw a good quote the other day which said it's the most common disorder that you've never heard of. It can affect anyone at any age, at any time, and it can often be disabling and life-changing. Some people may just have one flare-up and not have it again. Other people may have regular flare-ups of it throughout their life, and some people have persisting symptoms that don't go away. So it can affect lots of people in various ways. It's essentially a miscommunication between the brain and the central nervous system. It means that the messages that go between the brain and the central nervous system are not working properly. They're not being sent or they're not being received correctly. That can give a whole range of symptoms that can affect so many different parts of the body. So people with FND can have speech problems, cognitive problems, they can have limb weakness, they can have tremors, altered gait pattern, the movement disorders of all different kinds. They can have non-epileptic seizures, visual disturbances, continence issues, dystonia, pain, spasms, and sensation changes. So it really can affect so many different parts of you, and which then in turn affects your ability to function normally. So why does it happen? The brain is a predictive organ. So over your life, you learn how to do things and your brain can store those things subconsciously. We know that 10% of your brain is conscious and 90% of it is subconscious. So for instance, over the years, I've learned that how to pick up a cup of coffee. I know how to stretch my hand out, the power that I need, and everything to do that movement without thinking about it. I can carry on chatting with my friend. What happens in FND is that that movement pattern is disrupted and the brain becomes more conscious about thinking about that movement pattern. So for some reason the communication is wrong and that movement is disrupted. Your brain, the more you do it, your brain then learns that that's the right movement, and then that can be the new normal for you. And so whenever you go to do that movement, whether it's walking, picking up coffee, using a knife and fork, or talking, any of those symptoms that I mentioned before, that can be then the new pattern for it. There has been research completed with patients with FND and patients without it in a functional MRI scanner. The results found that people with FND have a higher proportion of blood flow to their amygdala, which is our emotional centre, and a less proportion of blood flow to the temporal parietal junction, which is our place of self-agency or control over our movements, compared to those without it. So this could suggest that patients with FND have a higher emotional relationship with their movements and actual less control over their movements. A lot of people with FND feel that they are not in control of their body. They cannot control the symptoms that they are seeing, which would make sense in regards to their to this functional MRI report. Diagnosis can take many years, especially if someone has other comorbidities that are alongside FND. But other people may come into hospital with a first set of symptoms and be diagnosed within a few days, because diagnosis is a positive diagnosis through the Hoover's sign or through a neurologist looking or watching at a patient's seizure to see if there's telltale signs of a functional seizure versus an epileptic seizure. It used to be thought that FND was a psychological issue and that there had to be some sort of trauma, emotional stressor, or other things going on that would trigger a physical response to that emotional stress. That may be the case for some people with FND. There is a higher proportion of people with psychological issues who have FND, but there are also patients that have no history whatsoever of trauma, distress, or anything like that. So it's really important to note that this isn't a diagnostic factor in FND. Thank you for listening to my vlog. I hope this has helped you understand a bit more what FND is. There's loads more that I could say about it, but I don't have enough time. So hopefully in a nutshell, that's done the job. Thanks very much. Bye. This vlog has been made to support my poster for my project that I have completed as part of the niche-funded Research, Evaluation and Quality Improvement Scholarship Programme, which is led by the James Paget Hospital. Please follow the QR code if you would like to see my poster in more detail. My project was on functional neurological disorder and exploring ways in which we can help this patient group.